Now, Eastern Cape Health is denying it's choking on an oxygen supply crisis. It says reports of service providers cutting supply is full of hot air. In fact, the DA says AFROX is threatening to stop supply due to millions in unpaid bills. But the department says it has already reduced the debt. eNCA's Ronald Masinda is on the ground for us on this story, and he has filed this report.
Nofoto Kebe was admitted to Frey Hospital in East London on the 25th of August. She says she suffers from asthma and is afraid for her well-being if she doesn't receive the necessary medical treatment.
Kodwa ke ndithanda ufika esibhedlela ndafakwa into ndarayithi ndinephika ndingakwazi uphefumla.
While many patients rely on oxygen to survive, the money owed to AFROX could force the oxygen supplier not to provide its services to the Eastern Cape Health Department. According to the Democratic Alliance, the department is putting many lives at risk.
So through parliamentary questions, we as the Democratic Alliance have also established that there are many debts to other service providers as well, and to suppliers of crucial medical equipment and medications. So this means then that the lists and the waiting periods for elective surgeries such as knee replacements and hip replacements are postponed further and further down the line. The waiting list is now 6 years at Livingston and 10 years at Frey Hospital.
The department, however, says despite its financial constraints, its main priority is to save lives.
We have been engaging on a regular basis with our creditors so that we can manage the current year's operations, even as we try and address the payments last year. So with effect from the 1st of April, we have been prioritizing our creditors, and we've paid off just over 60% of those creditors that we were carrying forward. AFROX, again, is one of those suppliers that provides an essential service, and so we have prioritized them, pharmaceutical companies, and our SMMEs.
The department says under its budget allocation of over 28 billion rand during this financial year, it is trying to find ways of reducing its debt with AFROX, and it is hoped that this will go a long way in ensuring that oxygen in the province is not in short supply. Ronald Masinda, East London.